Guru Nation, thank you again for watching. If you missed the webinar, you're going to be able to see it right after this quick intro video. So I actually forgot to hit record until 1/4 of the way into the video or into the webinar. So as soon as this little intro is over, you're going to hear Chris, who's the other person on the webinar, my business partner. You're going to hear him in mid-sentence, but we got a lot of the good stuff in there, and then at the end, because I realized we forgot to hit record, I did a quick summary of what you missed. But here's what you missed, right? As far as contracts and budgets are concerned, first of all, you must negotiate your contract and budget. You will not lose a study if you try to negotiate. Matter of fact, CROs already know that 20% of the sites will never negotiate their budgets, and they get to keep this as profit for themselves. Not only that, they subsidize the 20% of the sites that the CRO is willing to overpay because they have a proven track record that they provide good quality data and large enrollment numbers. So the CROs are willing to overpay them at your cost, right? So that's 40% of the sites, and that leaves 60%, the majority of the people watching. And your job is to get as close to the max as possible, because every CRO who's negotiating with a site has a max for that site. So they tell the person negotiating the budgets with you, hey, you cannot go past this max for this site, all right? And the person who's negotiating with you from the CRO side, they actually are given incentives, and we're going to talk about this in the webinar. You'll see it. They're given incentives to keep your costs down, so they're going to throw everything at you. They're going to throw the book at you, the Sunshine Act. They're going to ask for supporting documentation. They're going to ask for a whole bunch of stuff. So don't let that stop you. Just continue pressing on, find the max, and hopefully you can enjoy this webinar, all right? Talk to you guys soon, Guru Nation. Take care.
And again, because I wasn't interested in the trial, I didn't feel like coming back and saying, okay, we'll accept a lesser amount. Though the way the emails were phrased, they wouldn't have been willing to give us the study anyhow at that point. So there are limits to what you can push for. You just have to be cognizant. You have to be aware of what you're looking to do and what they're willing to pay. Again, 30% I would say is the baseline, the 30% increase. Yeah, you want to start out with at least 50%, but here again, you're going to want a little background information on what the assessments that are being performed in a study, what they're typically paid industry-wide. What is that assessment paid? For example, informed consent, I would say these days, typical informed consent is in the range of $110, $120. So you just have to be aware of what the typical costs are. You know, if you see a trial and they're providing $70 for informed consent, you know that's not industry standard. So you just have to be aware of this and negotiate accordingly.
Mm-hmm. So, and we're recording now, but what I'll do, because of people on YouTube who have to work now, they missed out. I do like these more intimate webinars, but we are recording now. So what we will do is give a quick summary right now, and then I'll go back and do a video, just an intro. Apologize for missing the beginning.
Sure.
Sort of talk about the cliff notes of what we discussed. So to summarize, okay, I don't know how many points we had, but let's just go. First of all, negotiate your budgets.
Yes, it's harmful to other sites out there if you're not getting the max you can, because what many CRO or sponsor I've seen do is they'll say, well, you know what, we've had 40 sites accept this budget, and I'm sure that's within the realm of truth. Therefore, if you're not willing to do so, we'll find plenty more that will accept this budget. So if you don't negotiate the budget, you're harming other sites as well, because they're not going to be able to get max dollars either.
Okay, so that's important. And that's rarely talked about. So it's affecting other sites, and it's collectively it's affecting all of us, because we're all in this as site owners to make a profit.
It affects your site as well. It affects you as well. You're not going to make as much money.
Affects your site as well. So point number 2, CROs are given a total budget, right, from the sponsor, of which it's still not clear, but as much as they can keep for themselves, they will. Um, Typically 20 to 30%.
And bonuses are handed out accordingly.
Bonuses are handed out to the contracts negotiators, right? So the people that are doing the negotiating with you, if they can keep you under a certain level, they get the difference.
Yep, they receive an incentive to get you in to do the trial for as little as possible.
A nice little Christmas bonus.
Yep.
The CRO already knows that 20% of the sites are not going to negotiate the budget at all. 20% are really good and they deserve top dollar. They're even out the really good sites, if you can prove time and time again that you can enroll on time, clean data, they're actually willing to make exceptions for those sites and pay them more.
They'll pay over a little over the top end.
A little over the top end, and that leaves.
Sponsor approval.
So that's 40%. So 20 that don't negotiate at all, 20 that can get more than what the max would be, in some cases, and then that leaves 60%, which is likely you guys and us too. So the variable is, can you get as close to the max as possible? Because it's, again, the person on the other end of your negotiations, they have incentives to keep your costs down. So they're going to throw everything at you. They're going to throw the Sunshine Act at you. They're going to throw, can you provide third-party documentation or supporting documentation, justification for your costs? You need to be prepared for all these objections that they're going to have. But the good news is, for the most part, as long as you can justify it, they will play ball, right? Because they're really counting on those sites that won't negotiate, and they're also counting on those sites that will kind of negotiate, but as soon as an objection is thrown up, the site will stop negotiating, all right? That's point number, I don't know. And then point number 3 would be negotiate as much of the cost up front as you can, meaning the first 3 visits. Let's say it's a 10 visit study. The CRO wants to keep most of the budget towards the end of those, like visit 7, 8, 9, and 10, because there's a possibility that those subjects won't even make it that far. So then they don't have to pay you that. But on paper, it looks like you're getting a great budget, but you can have the same exact budget as another site who front-loaded the budget versus backloading the budget. And yeah, the number might be the same overall, but in reality, because we know 20% of subjects, if not more, maybe 30% drop out and don't complete the study, the site that has the majority of the budget backloaded will not receive those funds ever. They just see them on paper. It was great. Maybe it's a moral victory, but they'll never actually see it. Whereas the sites who do negotiate properly, the way Chris and I do, they will put it in the front. So one more point, as part of our services for our consulting through DSCS, not only do we negotiate contracts and budgets for you, but we get studies for you. We do feasibility surveys for you. We help you with your SOPs. We get source documents for you. We train your staff. We do it all. Okay. I had an experience, and I'm going to repeat this story because it wasn't recording. We had a physician who was a potential client. He was actually referred by another client. He actually didn't sign up with us, right? But he's been doing studies for at least a year. And when I told him the services we provide, I said, not only do we get you studies and do the surveys and do the source docs, we also negotiate the contracts and budgets for you. And you will pay for our services for the entire year with the first budget we negotiate for you. And he said, really? Well, are you even allowed to negotiate budgets? Because I don't want to piss off the sponsor and lose the study. So I haven't been negotiating any budgets. And this is an educated this is a physician, right? this is a myth. It's a false assumption that if you don't negotiate, that the sponsors are going to come back to you. It's actually a red flag, right? It shows that your site is not knowledgeable or experienced in conducting clinical trials. And again, like I said, sponsor and CRO, really the CRO, because the sponsor could care less about what the CRO does with their money, right? But the CRO knows 20% of the sites will never negotiate. Another 20 will, and they deserve to be overpaid. And then that leaves the rest, 60%, right? And so that variable is there. So not only are you doing a disservice to your own bottom line and your own bank account, you're doing a disservice to all the other sites out there and ultimately to you on the back end as well, because the lower these budgets are negotiated on average, the more the CROs will try to take home for themselves on the next study. And we know because we're starting a CRO ourselves. And we started out as site owners. We have been doing it for 11 years. The good thing for you guys now is, and for us, we get to see what's on the other side of the curtain, right?
Mm-hmm.
So we see what's on the other side of the curtain. We're having sit downs with sponsors, with other CROs, with people who work in the CRO space. And we see how they operate and we see how they negotiate. And we're going to be implementing some of these tactics ourselves, but we're unique in the sense that we actually own sites as well. And that's primarily our bread and butter. So we're going to be passing along this information to you as we learn more. And anything else you'd like to add, Chris? Closing remarks, sir?
Please negotiate your budgets, and if you're unwilling to do so, send them our way.
Send them our way. Now, we won't do it for free.
No, of course not. But send them our way, and you'll be happy that you did.
Okay. Yeah. There was a time where I was helping sites do it for free.
Yeah?
Yeah, no more. I've grown up. However, if someone needs an overhead policy, that's another thing we didn't talk about.
Sure.
Overhead policy. Let's squeeze that in. We got 2 minutes.
Well, I mean, really, a policy for anything you want the sponsor to pay for. You need a policy for everything. If you can provide proof, they're more than likely going to pay for it.
Right. So they'll usually start out with as low as 10% overhead. You've seen it as low as 10, right? Sometimes 0. Sometimes they don't even put overhead.
True.
All right. So sometimes you'll get 0 overhead. And if that's the case, you turn around and say, no, our overhead policy is 40%. And here is our overhead policy is 40%. And here's our documentation. If you need that, email me and I will send you that. I'll gladly send you that. You can use it. We need more people to negotiate better budgets, as Chris said, right?
Absolutely.
And if you need our help with anything, like I said, getting studies, creating source docs, training your staff, negotiating contracts and budgets, give me a call, 949-415-6256, or email me, dan@theclinicaltrialsguru.com. And until next month's webinar, I'll see you on YouTube. I'll see you on Twitter. I'll see you on Snapchat. I'll see you on Instagram, Facebook, LinkedIn, wherever it is that you are comfortable. I'm probably there. So look for me, Dan Sfera, and I will talk to you guys soon. Take care.